Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Lisa Bari. She's the CEO at Civitas Networks for Health. Welcome, Lisa.
Thank you. Thanks for having me here.
Yeah, well, thanks for having us here at your conference. It's been a really fun event, but for those that don't know Civitas, tell us a little bit about yourself and Civitas.
Yeah, absolutely. So obviously I'm the CEO of Civitas Networks for Health. We are a national nonprofit member and mission-driven organization. We represent organizations across the boundaries of health information exchange, health improvement collaboratives, quality improvement organizations, all-payer claims databases, data collaboratives, and their various solutions and technology partners.
Awesome. So what are some of the big takeaways from the conference?
Yeah, I mean, first of all, conferences coming out of COVID, people really want time to work together collaboratively. We had great sessions this year. We have sessions from our members and their partners and government, industry, and all around. But people really gravitated to the really engaging live workshop style sessions. They want to work together. Specifically, our members who are health information exchanges want to work with quality improvement organizations and data collaboratives, and vice versa. They want to know, how can we work together to do what we call at Civitas, the bridge between data and doing. So our members on either side of the bridge, they're crossing the bridge, they're trying to say, how can I use my data to improve health? If they do health improvement work, how can I get better, more timely data and better tools to improve health?
Well, and I think that's interesting that, Civitas has always been known for HIEs, but you talk about 5 other stakeholders that are part of it. Talk about that, this kind of more than an HIE and the collaborations that happen.
Yeah, absolutely. So Civitas actually was founded in 2021 when we brought together 2 organizations. So one was SHIEC, the Strategic Health Information Exchange Collaborative. That was the organization that primarily represented HIEs, and the other was the Network for Regional Healthcare Improvement, which had a whole membership of quality improvement organizations, health improvement collaboratives, all-payer claims databases. So we actually combined 2 organizations in their membership to create Civitas. So Civitas really represents that broad group of these neutral, nonprofit organizations working in that space, and then all of their business and technology partners.
Awesome. Well, we can't have a video about interoperability and not say TEFCA and QHINs, which has been a big topic here. What are you hearing?
Yeah, I think we heard a lot of feedback that people are feeling a good amount of anxiety about the long delays in actually implementing this work. TEFCA was actually from the 21st Century Cures Act back in 2016. I was in government then at the time, and it's been a long time coming. Those delays are really tough for all kinds of players, whether they are technology companies or whether they are the neutral nonprofit regional and state HIEs or anybody else in the space, because this is, these kind of things like joining TEFCA or joining a QHIN, that takes a ton of money and a ton of time and investment. And so stretching it out so far is really difficult. So a lot of anxiety about the delays and the timelines. And so I think that, we were very eager to see things move forward, but also to not ignore what's happening at the state and the regional level.
Okay.
You can have what we call health data utility, which is these regional and state fulsome networks that include all kinds of different aspects of improvement. But then you can also have national networks and frameworks, and they can happen together. They have to happen together. And so I think making sure everyone understands that there's space for both, space for all is really important. But when you talk about TEFCA specifically, we've heard a lot of people saying, hey, how many years has it been? Let's move forward. Let's apply those investments and not do anything to stop the great work already happening in the space.
Yeah. So you mentioned health data utility, HDUs, as people are calling it, because it's become so commonplace. It's just a common vernacular here now. Where is that headed?
Yeah, definitely. Well, what we're seeing, so Civitas and its partners and members released a health data utility framework earlier in the year. And, that work has been sort of the culmination of looking at what's happening across different regions and states. Where it's headed right now is we're seeing efforts to create health data utilities in multiple states or expand them that are already there. So we really say build on what's already there. If you have a HIE, if you have a quality improvement organization, combine your forces, have a partnership, make this resource for your entire region or state. So we're seeing a lot of efforts push from the HIE side, and now we're seeing efforts push from the quality improvement side and the public health side. So that for us is a real sign that we're getting some real traction. It's moving in different directions toward the concept of health data utility in multiple regions of the state. So that's really exciting to see.
Yeah.
We're going to do more. We have all kinds of plans with our members and partners. This conference was really like, where are we now? And let's keep it going.
Yeah. Where do you see Civitas kind of its role evolving going forward?
Yeah. Well, what we're hearing, we were created really 2.5 years ago. And so first couple of years are like getting to know each other. Where are we? Who are we? And now we have over 165 members. We're in almost every state and region. And what we hear our members saying is, help us do this more specifically. Help us combine HIE and QIO work. Help us bring in our public health and our Medicaid and state partners in a more specific way. Help us make sure our governance models are more inclusive. And so I think that that's what we're hoping to do next.
Awesome.
Yeah.
Well, Lisa, I think you're the most in-demand person at this point for obvious reasons. So I appreciate you taking time to share this.
Thank you so much. Thanks for being here and for talking to so many of our members and partners and bringing their stories to your audience.
Yeah, it's been a lot of fun. Well, thank you. And thank you everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Lisa.
Thank you.